don't we go ahead and get started with some introductions. My name is Scott Britton. I'm coordinator for Advocates for Ohio's Future, and I want to apologize on behalf of our co-chair, Gail Channing Tenenbaum. She is ill today and unable to make it. We were hoping at one point to conference her in, but she's at the doctor's office right now, so we're hoping she'll have a speedy recovery. I want to take a moment to have all of the partners with Advocates for Ohio's Future, those who are on our steering committee, introduce themselves so that the media knows who the experts are in the room, and we may end up deflecting some of your questions to them. So you want to start over here? Introduce themselves in just a moment, but we have a few people trail in. I just want everybody to feel comfortable getting up to get some food and drink as we go through. This is fairly laid back. We're not going to take up too much time, but as the statewide coalition for health, human service, and early care and education, we wanted to sort of take a breath now that the budget bill has passed the Ohio House, and as hearings begin tomorrow in the Senate Finance Committee, specifically targeted toward Medicaid and human services, to tell you what we hope to see change in the budget that as far as services directed at vulnerable Ohioans. As many of you know, we are a coalition of more than 20 statewide associations that cover just about every area of health, human service, and early care and education. Many of them are sitting around in this room. Our mission has been endorsed by more than 200 organizations across the state. I believe we're up to 203 now. And we've been around for 8 years under our former name, the Campaign to Protect Ohio's Future, lobbying for health and human services in the state budget. I wanted to just start by saying that a safety net that's already in shreds from 4 years of state budget cuts really cannot begin to handle today's rising demand for services. The recession has increased the need for basic health and human services at a time when government has fewer resources to provide them. Long lines at food pantries, steep cuts to public services across the board, waiting lists for care, all point to a need for shoring up Ohio's safety net. Recent reports on the number of Ohioans living at or below the level of self-sufficiency reveal a state where too many children, families, seniors, and people with disabilities are vulnerable. I want to direct you to a map just behind our news release in the packet that shows county by county the level of the population living at or below that 200% of the federal poverty level. 70 have more than 1/4 of their population living at that level, which is also known as the self-sufficiency level, making them eligible for emergency food assistance and other safety net services. 26 of those counties have more than 35% of their population eligible. Now, we're going to have some faces today talking about the need for these services, but I think that this map puts into context the need that is out there. A jobs budget, as it's been called, that reduces unemployment is really only part of the answer. The Great Recession has caused the face of poverty to change over the last 3.5 years. In fact, many of our neighbors who are standing in those food pantry lines, signing up their children for Medicaid, and relying on other public assistance programs are already working full-time. This budget must offer those working poor who are suffering because of wage stagnation, underemployment, and low-paying jobs a lifeline. They need relief from hunger, homelessness, mental illness, addiction, and other issues so that they can remain self-sufficient until the economy recovers. If we fail to invest in services that ensure an educated, healthy workforce, these Ohioans will be poorly positioned for when prosperity returns. Along with new jobs, this budget should prioritize workforce supports for those who, despite working hard every day, still fail to provide adequate food, health care, and security for themselves and their families. Adequate investment must support proposed reforms if they are going to be successful. Bold policy reforms to shift services for seniors, people with disabilities, and those requiring behavioral health services away from the expensive institutions and into less expensive home and community-based settings will fall flat if they are not adequately funded. When those with mental illness and addiction do not receive the help they need in their community, they end up in hospitals, psychiatric wards, and prisons, and nursing homes. If seniors and people with disabilities do not receive the services they need to remain independent, they end up in costly nursing facilities. If the budget is to be successful in saving money in the long term by spending less on institutionalized care, then significantly more investments must be made now in the community behavioral health and waiver systems. Our message today is that any new revenue identified during the budget process must be prioritized for health, human services, and early care and education programs. Ohioans have enjoyed tax cuts since 2005. The rainy day is upon us. If revenue projections increase, then those additional funds must be used to improve vital services for Ohio's most vulnerable. At this point, I want to invite Margaret Hulbert, who is co-chair of Advocates for Ohio's Future and also with United Way of Greater Cincinnati, to come up and talk from the perspective of charitable organizations.
I don't want to take too much of your time because I recognize most of the press faces at the table, and you've heard this before, but it is an important thing to remind people out in the public and to remind our elected officials. There is, I think, a growing sense within this country that we want to see government shrink. And I think that is driven by a small group of people who have not conveyed a clear understanding of what government does. Valerie with Central Ohio United Way and I get the privilege, and I do say it's a privilege, of working for an organization that every day sees how generous people in our communities are. I literally have watched people who know they were laid off still make a contribution to United Way because they saw that as something that would help other people who are facing similar situations. So every day I see in the rich and in the poor and in the middle class that they will dig deeply into their own pockets to help individuals meet their basic needs. And yet we have a philosophy now that's driving how we look at government as if government isn't part of that equation, and it's very much part of that equation. My organization raises about $60 million every year. That number has not gone up in a number of years. I think that's a testament actually to people because people's incomes have gone down significantly. So that means they're digging deeper to help others. But it also is a reflection of why we can't count on the private philanthropic sector to pick up the slack as government stops doing what government has traditionally done. And what government has traditionally done is to provide the largest amount of money for health and human services and provide the significant pieces of a basic safety net that tell people when things are at their worst and you need us the most, we will be there. I don't mean that private philanthropy should walk away by any means. I think we're doing as much as we can to maximize our resources, make sure that the agencies that provide the services are efficient and effective. My agency and many others have gone to zero-based budgeting. We do not take for granted that because you provide a service, you will continue to provide it. We measure it. We work with you to make sure it is as effective as possible. We emphasize continuous improvement to the point I would tell you that the agencies that remain in our funding portfolio are absolutely getting the outcomes we want from them. But even as effective as they are, they cannot do it alone. That is a responsibility of government. Valerie's put together a really nice little piece in here. It's about a year old, but it kind of tells you the trends in philanthropy and what's happening out there. And what is happening is exactly what's happening with the rest of the economy. Portfolios are down, so private foundations cannot fund as much. United Ways are flat or decreasing, even though people are as generous as they can be. So we really are calling on the state, the governor and the House, but right at this particular moment, the Senate, to recognize that as revenues increase, and apparently they are, and apparently we will have additional revenues, that the last thing they need to do is to give those revenues back to people who don't need them. And the most important thing they can do is invest them in safety net services for the people of Ohio. Thanks.